Welcome back to the Medical Board Exam Experience with Dr. Kwafo. Dr. Agawal is an international medical graduate from India. He has successfully passed the German language exams and also the German Medical Council Board exams, and is currently into the Orthopedic Surgery Residency program in Germany. He has joined us today to share with us his residency journey and all that we need to know about the German Medical Council Board exams. He has also permitted me to leave his contacts under this YouTube video, so anyone who needs further clarification concerning the German Medical Council Board exams can keep in touch with him. Let us join Dr. Agawal. Viewers, on this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exam preparation experience with us and with all those preparing to write theirs. I encourage anyone watching me at this moment to kindly subscribe to this channel and also recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. If you have experience with the board exams of any country and would like to share with us, kindly reach out to me on my Facebook page, Instagram, or leave a comment at the comment section under this video and I'll keep in touch. Okay, welcome Dr. Agawal. So my first question is, what is the German Medical Board exams and who is qualified to take it?
Thank you for inviting me here. I will explain all the steps one by one. So the first and the most important thing is German language. The doctor or dentist whomsoever wants to work or wants to do his medical residency post-graduation in Germany, he or she has to learn German language. This is compulsory, and because we have to communicate with the patients and they speak German language. So everything is in German language in Germany, and this is compulsory for everyone to learn German language, which has 6 levels: A1, A2, B1, B2, and C1, C2. As a medical doctor, one should have at least minimum B2, means 4 levels. But nowadays the competition is too high. So like I suggest everybody to go for C1, 5 levels. From A1 till C1, they have to study German language. They can study in their home country or they can study in Germany. That is upon their own wish. After completing C1 language, one has to learn the patient communication skills, we can say, or we can say the medical terminology. Like from A1 till C1, this language is like a journal language, what we daily use in our daily life. But apart from that, what medical terminology we know, that is like what we call brain, eyes, nose in German language. So all the medical terminology we have to study in German language. That is a medical terminology exam, which is called as Fachsprachprüfung, specialized exam, in which medical council will going to test your skills from A1 till C1, like journal language, as well as your medical terminology. So after passing FSP, in short form we called as FSP, Fachsprachprüfung, one will get a temporary license, which is called as Berufserlaubnis. With this temporary license, one can start working in the hospital. Like suppose somebody wants to go for orthopedics. So he has to find a position in the recognized hospital or in recognized university hospital, where he can get trained himself under some doctor, and there he will start his job on the basis of temporary license, which is valid maximum for 2 years. Within 2 years, the medical council will give him a date for the Kenntnisprüfung. Kenntnisprüfung, this is the medical licensing exam in which they will going to check your medical knowledge. So this exam you have to pass, and then you will get approbation, which is a permanent license, and you can start your post-graduation. So what is the difference? Like, as I said, you have started working in the hospital in orthopedics department after temporary license. But you start your PG only once you have your permanent license, that is approbation. The difference is that after temporary license, once you are working in orthopedics department, that period until you have permanent license, that period will not be counted as a part of your training. Suppose orthopedics, this is of 5 years, and you have worked 1 year on a temporary license before giving permanent license exam. So that 1 year will not be going to be considered as a part of your post graduation training. The day you have got your permanent license, from that day they will start counting day one
Okay.
until 5 years.
Okay.
After 5 years, you will have to go to the medical council. You have to write a board exam and you have to pass that exam in the medical council, and you will be getting a degree from the medical council. So
Okay.
then you will become an orthopedic surgeon. So this is like, in a short form, I have explained the pathway.
Yes.
First A1 till C1,
Mm-hmm.
then FSP, and then Cantonese Profound KP in short form.
Okay.
And then you will get your approbation permanent license in Germany, and you can start your residency.
Okay. So what you're saying, first you have to, they will test you on the English language, the A1 to C1, right?
It's German language.
The German language, sorry, the German language. So you
Yeah.
have to pass all the A1, B1, all those German language tests, right?
Yes.
Okay, so after that, then you have to also take the FSP.
Yes. FSP Volkssprachprüfung.
That is not medicine course. Is it also
No.
it's also for languages?
Yes. This is also for the language in which they will going to check like how you will going to talk to the patient, how
Okay,
you will do
and
the physical examination.
it's not part of the board exams.
No, this is not a part of board exam.
Okay, so after the FSP, then you pass the FSP, then they give you temporary license.
Temporary license for 2 years.
So is that license supposed to give you opportunity to write the board exams, or you have to practice for 2 years before you can qualify to write the board exams?
No, it's not compulsory that you take the temporary license and start working. This is not compulsory for you to write the board exam. But as you know, because doctors are coming from outside Germany, outside European Union,
Yes.
and they don't have any knowledge about the German medical system, about the
Okay.
insurance plan, about the pension plan.
Mm-hmm.
So one has to learn everything while working in the hospital.
Okay.
Nowadays, because instantly, like the day you pass your FSP, after that you will not get the Cantonese Proofing date, medical licensing exam date. That will take 6 months to 1 year
Okay.
because there's a huge number of application and you have to wait. So why to wait and sit idly at home? So it's better to take the temporary license and start working in the hospital. Not only you will gain a knowledge, but you will be paid by the hospital in the same time.
Okay. So what you're saying is to qualify to write the exams after passing the FSP, you have to wait for a while before you can write the board exams.
Yes, you have to wait for 6 months to a year, and
Okay.
medical council will themselves going to provide you the date for the country's perform medical licensing exam.
Okay.
And this, like I will discuss the content of the exam, both exams, FSP and KP.
Yeah.
Okay, so they will going to give the date, and on that day you have to go and pass this exam.
So the what you're talking about, the board exams or the FSP?
KP, country's perform.
Okay,
After FSP, you have to give KP.
the KP is the medical board exams.
Yes, that is a medical licensing exam. This by
Okay.
this passing this exam, you will get a permanent license to work
Okay.
as a doctor in Germany.
Okay. Okay. So then let's start from the language part. How long did it take you to write all the language tests from A1 to C1?
See, I have done my A1, A2 in India,
Okay.
and after that, I came to Germany from B1 onwards. So I completed my B1, B2, C1,
Mm-hmm.
and total like in India, it takes time because there is only one institute, that is Goethe Institute, in which you have to study,
Mm-hmm.
and there's a lots of students. So sometimes you get a chance, sometimes not. Maybe sometimes you don't get a chance to write the exam.
Okay.
So it takes time. So waiting list is too huge, and the one level is of 3 to 4 months. So they take the exam and then they give the result after 1 month. So that, like for A1 A2, it took me around 1 year to complete in Goethe exam, Goethe
Okay.
Institute.
But do you have to write the
But
A1, A2 before you can write the B1 or the C1? Is it compulsory
no,
to
that
start
is
with?
not compulsory. You can study all the levels and go for the last one. It's not compulsory to write each and every level.
Okay, but you need the C1 to write the FSP.
B2.
Okay, B2 is like you need B2.
B2,
Okay.
yes, minimum B2. But once you apply in the hospital for your residency position, at
Mm-hmm.
that time, because everybody have B2. So what's the
Okay.
difference in applications? So in
Okay.
order to make some difference, in order to make your application much better than with
Mm-hmm.
others, go with the C1.
Okay.
It
Okay.
will increase your chance in getting the residency in Germany.
Okay. So that now that so where did you learn the B1, B2, and the C1 in Germany? How did you learn it?
It was not so difficult for me. Like in the beginning, once when you start with A1, A2, it's really difficult, I would say, because this is the beginning and this is you will see something new world. Everything changes, like all the terms, everything. But once you finish your A1, A2, it will slowly and slowly, it will go easy.
Okay.
I would say like German language is not very different from English. Most of the parts, most of the things you will see like they are much similar to English.
Okay. So are there specific books you use to learn those languages?
Yeah, there is no specific books. There are 2 3 books which Goethe Institute they provide, and the one is Studio D,
Okay.
and the second one in Germany we use Zischer.
Okay. So
Yeah.
okay, the FSP. How is the FSP like? What is the content of the FSP?
Yes. So FSP exam, this is a patient communication exam in which they will not going to check your medical knowledge. They will just check how you will going to treat the patient, how you will going to talk to them, and how you will going to do the documentation. So this is the oral Viva exam of 60 minutes, having unlimited attempts. You can make as many as one. So it has 3 parts, 20 minutes each. In the first part of 20 minutes, you have to go and you have to do the physical examination. You have to take the case history of the patient. So like everything you have to write on paper. Then next 20 minutes, you have 20 minutes to write and to formulate everything nicely in German language on paper. Like what you have done with the patient, lung examination, heart examination, heartbeat, pulse, blood pressure, everything you have to write.
Okay.
There you will get 20 minutes.
Mm.
The last 20 minutes, the doctor will going to come and you have to give tell about your case. Okay, this is called as Vorstellung. You have to introduce your patient. You have to tell the doctor that my patient is so and so of this much age, why she came to the hospital, what are the complaints, everything you have to introduce her in German language. The
Okay.
result they give you just after the exam. This is a non-competitive exam,
Mm.
either pass or fail. Once you pass the exam, you will get a certificate and then you can apply for the temporary license.
Okay. So if you get a certificate and you don't want to apply for the temporary license, you can just go straight to write the board exams, the KP, right?
Yes.
Okay.
You can also do that, but as I told you, it will take time, 6 months to 1 year, and you have to do something in order to extend your visa. You cannot
Okay.
sit idly with doing nothing and they will going to extend your visa. It's not possible. So you have to do something.
Okay. So, but these exams, are you supposed to be in Germany to take it? Can any of them be taken outside Germany?
No, that is held by only the medical council. In the medical council, Germany has 16 states. Each state they have their own medical council. There is no national medical council over here like GMC in UK. So every state have their own medical council, and you have to write this exam inside the medical council. So
Okay.
you will get a patient, you will get doctors over there, everything.
Oh, okay. Okay. So the KP exams, how is it like? Is it MCQs, theory? How is the KP exams like?
KP exam, it's a medical licensing exam,
Mm-hmm.
which you can write maximum 3 times in Germany.
Okay.
It is also an oral viva exam of 90 minutes.
Mm-hmm.
First, divided in two parts, 30 minutes and 60 minutes.
Okay.
First 30 minutes, you will get a real patient in the hospital. You
Mm-hmm.
have to diagnose, you have to do all the physical examination. You have to write everything, treatment, differential diagnosis, causes, symptoms, whatever you have seen in the patient.
Okay.
Okay, 30 minutes is for that. Then next 60 minutes is divided in three parts, 20, 20, 20.
Mm-hmm.
There will be three subjects, there will be three examiners, one from the internal medicine. He will going to ask you the questions about internal medicine for 20 minutes.
Okay.
Questions are like, I would say like about, let's say diabetes or hypertension. You have to tell the causes, symptoms, differential diagnosis, treatment, all those things.
Mm-hmm.
Then the second doctor from will be surgery. He will going to ask you question for 20 minutes. There he will going to ask you about, let's say, inguinal hernia, appendicitis, acute pancreatitis. So you have to tell everything, causes, symptoms, treatment, everything. The last 20 minutes, the third examiner, it's this is optional. Like you will come to know about the third subject 1 month before the exam. It could be anesthesia, it could be ENT, it could be obs gynae, it could be anything. So the medical council will going to inform you 1 month before the exam about your third subject. So the third one going to ask you the question from the same field for 20 minutes.
Okay. Okay. So how long does it take to get the results?
Same day. Just after the exam, after 15, let's say 15 minutes, they will going to declare the result. This is also a non-competitive exam, just oral viva. Either pass or fail result will be declared.
Okay. Okay. So are there specific materials that, because it is in German language, right? So are there specific
Yes.
materials that a foreigner has to use to help him pass the exams?
Yes, there are certain books like Fall book for chirurgy. Fall book means case book for surgery. Fall book for inner medicine means a case book for internal medicine. In these both books, you will find around 300 cases, 150 for internal medicine and 140 for surgery. Total 290 cases will be there.
Okay.
Apart from that, you can use last minute pharmacology. You
Mm,
can use radiology, and the best one is there is a software, there's a website called Embose. You can log into Embose. It's very cheap, €5 per month. You can take the subscription for 1 year. It will cost you 70 or 72 euros. And this will be very benefit for you. You will find each and every topic over there in German language, and it's very good formulated. Even they have a videos where you can see all the examination.
okay. So did you attend any special classes or lectures to prepare for these exams?
See, when I came here, that time the classes like there were not so much. Uh, it was not so much famous for the Cantonese perform classes. Yes, for FSP I took the classes, but not for Cantonese perform. While working in the hospital, I have got experience, and then I have studied for myself, and then I have written the exam.
Okay.
But nowadays in 2020, the exam it's not so easy. It's really little bit, I would say, difficult,
Mm,
and one should take the classes. Now there are different institute, different schools are there who will give you the FSP as well as KP both guidance,
okay.
coachings.
Okay. Okay. So how much is the registration for the FSP and the KP? How much does it cost?
As I told you, there are total 16 states and they have their own medical council. So
Mm-hmm.
each state have different fees, registration fees for both the exam. For
Okay.
FSP, it starts from €300. It goes to 1,000 euro, and same with KP also.
Okay. So when you said the KP has to be taken in Germany, the FSP can
Yes.
it be taken outside Germany or inside Germany?
Yes, I'm sorry, I'm not getting.
The FSP can also be taken outside Germany, or you have to be in Germany
No,
to take it. Also in Germany.
just you can only learn language from A1 till C1 in your home country.
Okay.
FSP and KP, it is compulsory for you to be in Germany.
Okay. So when you want to come to Germany to write these exams, what type of visa do you have to get? And is the council giving you invitation letter, or how is it like?
See, first of all, you have to learn language, as I told you. At least you should have A1 or A2 certificate. Without this, you will not get a visa.
Okay.
And then you can proceed from B1 either, or if you have learned still C1 in your home country, then you can proceed from FSP.
Okay.
So either start from B1 or from FSP. So
Okay.
this is the student visa. This is a national D type long-term national visa you will be applying,
Mm-hmm.
and you will be getting this visa.
Okay. Okay. So how much does doctors or residents in Germany take their salary? If you have any idea about it.
Yes, in 2020, every year they have doctor's tariff. In 2020, it is around 4,600 euro for the first year of residency.
Okay.
It starts,
Every month or the whole year?
sorry,
Is it every month or the whole year? 4,000 for the
for
month?
every month. It will start just after passing your FSP. The amount, the salary will going to remain same. It doesn't matter you have a temporary license or permanent license. The
Okay.
day you start working in the hospital with a permanent license, you will get 4,600 euro, which increases every year 5 to 6%.
Okay. So, per your experience, are there a lot of foreigners practicing in Germany?
This is a good question. I would say, like, if you come to Germany in the hospital, you will say on the head of department or senior consultant. They are Germans, and all doctors below them, they are foreigners.
Oh, okay. So, will you
Yeah.
encourage a foreigner someone who is studying medicine outside Germany to take the Germany exams?
Now, I would say 70% doctors are immigrants here in Germany. All are foreigners from different part of the world, mostly because they are from Syria because of the war, refugees. So the highest number of doctors they came from Syria. Otherwise, they are coming from all over Europe, from Poland, from Romania, from India, from Pakistan, Bangladesh, Sri Lanka, from South America, from like Peru. So here you will find lots of variety,
Did they have their
diversity.
medical education in Germany or outside Germany?
They all have medical education outside Germany.
Okay, okay. Then, so
Yeah.
if someone wants to take this journey, or someone wants to look up to you as orthopedic, having your residency in orthopedic department, is there any help that you can offer for anybody who wants to start this journey?
Yes, of course. Like because of this, in 2018, I have founded a company with the name of Eurizone Education Private Limited.
Okay,
And with this company, I am helping lots of doctors. I have already helped lots of doctors in achieving their dreams in coming to Germany.
okay,
And from the very beginning, from A1 until they get their permanent license, until they get settled in Germany. So the whole process, I'm going to guide them. I'm going to tell them how they have to do, how they have to execute it. Because see, there are lots of people in the market who are misleading the doctors, who are having agencies, and they are misguiding the doctors.
okay.
Because before coming to Germany, I was also having the same problem.
Mm-hmm.
And they always push you, just they will tell you how to enter in Germany.
Okay,
Okay. But they will not tell you how to go through the process, how to achieve your goal.
Mm-hmm.
So my mission is not to train them or to guide them just to how to enter in Germany, just how to get your visa and come here. My
Mm.
goal is to guide them until they get your approbation, until they start their PG.
Okay.
Maybe after that also.
Okay. Then I will leave the details of your company in the description button so that viewers can find it and keep in touch with you. Anybody who wants to take the Germany journey. So, do you have any
Yeah.
advice for anybody or American student who is studying outside Germany and wants to, in the future, write the German exams? What is your advice for the person?
I would say like I tell you about my experience before coming to Germany. I was also looking for different countries like US, UK, Australia, some English speaking country.
Yeah.
But going over there and writing the exams and getting through the exams also will not going to it was not looking for me to that I will going to achieve my goal.
Yeah.
So in Germany, the first and the most important thing is that you are getting your branch, you are getting your residency in your own field. Whatever you want, you can choose it. This is
Mm.
the best benefit over here. Okay,
Okay.
there is no ranking system, there is no competition. Just you have to pass the exam and you can find a job in the same department in which you want to continue.
Okay.
So whatever you want to become, like surgeon, internal medicine, anesthesia, ENT, whatever you want, you can choose it. Nobody will going to give you or nobody will going to force you to take any particular branch.
Okay.
Okay. The second thing, you don't have to pay a tuition fees. It's totally free of cost. Instead of that, hospital will going to pay you money every month.
Okay.
And this is, I told you the basic salary. I have not counted extra hours and night duties. If you count that part also, then maybe it will add about 2,500 euros more each
Okay.
year, each month.
Okay.
So my suggestion to all the doctors, all the medical students who are studying right now, if they want to do their PG outside their home country,
Okay.
then try to find your way which can take you to achieve your goal.
Okay.
Okay, so I find Germany is the best one. Just a language barrier is there, but language is not so difficult. And if you want to come here, it is a very good country. And after like Germany is the second immigrant country after US,
Okay.
the best in economy in Europe.
Okay.
So I would say like this is the best country if you want to do your post graduation,
Mm-hmm.
because all other countries they are not inviting you. You yourself going to these countries like US, UK. But
Mm-hmm.
Germany is inviting doctors. They need doctors and they want you. So the process is much easier as compared to other countries, and
Okay.
you can able to make it.
Okay. Okay.
Yeah.
Okay. Thank you, Dr. Agawal, for joining us today, and we hope to have you again on our platform. Thank you very much.
Yeah, sure. Thank you. Thank you very much. And I wish everybody good luck for your future.
Okay. Thank you.